Welcome back in. Well, we're wrapping up the final week of Colon Cancer Awareness Month. So we have a colon and rectal surgeon, Dr. Mark Parker, joining us now live via FaceTime. He's from Princeton Baptist Medical Center. Thank you so much for joining us, Dr. Parker.
Thank you.
All right, so let's talk about it. Obviously, a very important cause here, and we just want to get into it. Why is it so important to get screened for a colonoscopy?
The main thing we talk about with screening colonoscopies is this is one of our curable cancers. Cancer in the word and definition scares so many people in America, and especially in the South. And we really have to get the word out that when it comes to colon and rectal cancer, if we catch it early, it's curable. And so we just really are trying to spread the word so we decrease the amount of fear and understanding. We just got to get our friends and family in to get screened.
Now, what is the normal age that you guys sort of suggest, Dr. Parker, that people start to get these screenings? I know a lot of people, especially in their younger ages, sort of wait until they get older. They don't think it would affect them.
Well, definitely, as everybody who's listening understands, older is a state of mind. And as I get older, that age looks different. But for the screening standpoint, everyone in America, regardless of symptoms, should be screened at age 45. And that's a decrease from age 50. But just this last year, the consensus opinions have been able to change that screening age to 45. So that is the asymptomatic, have never had a problem with your bowel movements, have never seen blood, but just walking around everyday person should get their first screen at age 45.
Now, colon cancer or colorectal cancer, a lot of people, of course, we talk about breast cancer, but colorectal cancer is pretty common as well.
Absolutely. It is the third most common cancer in America for men and women, which again is there's only 2 screening tests for men, which would be the prostate and colon that we can check for. There's 3 in women: breast cancer, cervical cancer, and colon cancer, where we can truly screen and make a difference. And so for men and women in an educated city like Birmingham, but also just with the ability we have in social media, there's not a reason any longer for anyone not to get a screen.
Yeah, Dr. Parker, talk about some of those signs of this colorectal cancer. What should people look out for?
Absolutely. So again, hitting this point home, the #1 sign of colon cancer is none. Many people present asymptomatic when we find their polyp or we find their cancer. But the alarming symptoms that we should know about have to deal first and foremost bleeding with your bowel movements. Many people will not pay attention to bright red blood because they believe that's from a hemorrhoid or something at their bottom, when in reality, a low-lying rectal cancer can produce bright red blood. So bleeding is always a sign to be worried about. Secondly, a change in bowel habits. Maybe you've always been a once-a-day person, but now you're dealing with some constipation, and that's a change for you. Well, that needs to be paid attention to, especially if you're above age 40.
All right. Thank you so much, Dr. Parker, and some other symptoms as well there. I'm sure that you would want to share with us, but unfortunately time won't allow us. Thank you for joining us. Can anyone, do you have a website very quickly that people can get more information about this?
We do. We have 2 websites. Our clinic is ACRIPC.com, and then also our foundation, which is the RumpShaker5K.com foundation, also has plenty of links to colon cancer awareness and how people can participate with us. Thank you so much for the opportunity.
Thank you so much for joining us, Dr. Mark Parker. All right, and I actually participated in the Rump Shaker 5K this weekend. A beautiful cause there. All right, well, coming up, we're going to help parents